Hello, and welcome to Hanratty on Karate. So, my last podcast, I started talking a little bit about my instructor's program, which contains 22 modules, or sections if you like, on all the various subjects you'd expect to come across if you're instructing karate. Particularly Shotokan karate, that's the one I know the most about. So, between then and now, actually, I had an inquiry about injuries. Now, in my handbook on Shotokan karate, I did a section on injuries, treatment of injuries, what injuries you're likely to come across in a dojo, and what treatment you could maybe do before seeking professional medical help. Now, I insist on everyone who goes through my instructor program on having St. John's Ambulance or Red Cross certification in first aid training. And I think this is important for anybody who's involved in any group activity. And if you're teaching groups, whether it be children's groups or adult groups, whether it be yoga or step classes or in our case karate. Now, one thing I've noticed over 50 odd years of teaching is karate does not get a lot of injuries. We don't generally pick up a lot of injuries. Those we do get tend to be with people trying to do, they come back and they've lost a little fitness edge, and then they try to do what they did when they were training, and then what happens is you get some strains, and you get some just basically muscular injuries, soreness, and stuff like that. What we don't get are any major injuries. The most we'll get is maybe an abrasion, a fat lip, a nosebleed, and not always a nosebleed from contact, but just generally a nosebleed because maybe your BP is high, your blood pressure is high, you're running your heart rate high and everything else, and other factors that contribute to nosebleeds. Like we have a particularly dry atmosphere here in Calgary, and we're at altitude, and this does contribute to nosebleeds in some people. But they're minor things, minor injuries, and not even injuries if you like, they're more like just the way people are built. Having said that, the way people are built, I think what an instructor also has to look at is when somebody comes into his dojo to start training, if they have any injuries to start with, any genetic problems that would restrict their training, would leave them maybe not able to do everything that everybody does. I mean, you're going to get this anyway. I mean, not everybody can perform in the same way. And usually it's genetics. Sometimes it's just lack of exercise. And I have a little saying in my karate club: don't do karate to get yourself fit. Please get fit to do karate. Because if you want to get the best possible performance and employ the best possible techniques, you're going to need to be fit. You can't do, say, like a Toby Maigeri, which is a jumping front kick, if you've been stuck behind a desk for 10 years and you're just coming into it. Or if, in fact, you have a child that's not particularly active, overweight, whatever. Now, there's various methods we have of getting people into condition, and we employ a lot of them in our club. But having said that, and I'll come back to that, what we did want to make this little chat about is sports injuries and how to spot them, what to do about them, and how to prevent them. And of course, one of the ways of preventing any sports injuries is making sure you're fit enough to do the activity required or the technique that's required. Don't try throwing Jodan Mawashis or head kicks and everything else if you've got bad hips or you've never lifted your knee above your waist. It's not going to do you any good. So sports injury is any injury that's defined as one that disables the athlete or student. And the degree of disability will vary depending on the nature of the injury. So you have to decide how to care for any particular injury that you get. So it's important to know what tissue is involved if it's a tissue injury. Is it a muscle, tendon, or ligament? If it's a skeletal injury, bone or joint, okay? And the body area involved is really important. Head, very serious. Neck and back injuries, all serious. And you treat them a little different than you do to injuries to limbs. Then you want to know if it's a strain, a sprain, or a fracture, okay? Is it mild, moderate, or severe? We group them into pretty obvious if it's severe, okay? I mean, if you've got a broken arm and you've got an obvious deformation of the way the joint looks or the way the bone looks or protruding, then, hey, that's severe. Let's do something about it, okay? So when you're evaluating injuries, and some of them are quite minor, hopefully in your club they are minor, what you need to do is get a little history of what happened. Now, you may see what happened, or you may not, particularly if people are working in pairs and everything's going like crazy. So you want to know it was from an impact, like a kick or a punch or a fall, impacting the floor. You want to know if it was a twisting action or direct force, like if somebody puts you in an arm lock and you're using a pain compliance technique, then you can get injuries from that, all right? Try to isolate the injury. Not just, I'm in pain. Where does it hurt? What were you doing when it happened? And what position were you in, right? So then you're going to check for abnormalities, such as a skewed alignment, deformation, swelling, discoloration. All this, if it's not obvious, like if nobody's bleeding, right? Or there's no skin removed, like in an abrasion industry. Check for if there's any difficulty in bearing weight or pushing, try the range of motion slightly, unless it's really obvious. If it's making strange sounds, such as a grating sensation, does it feel tender? Look at the range of motion of the injured area and compare it with the normal uninjured range of motion. Maybe if it's an ankle, check the range of motion on the other ankle, check the weight bearing, have a look for discoloration or deformations, okay? Any doubt, any time about the severity of the injury, then you refer your student to a doctor and make sure that you have an emergency checklist in your dojo, what to do if this happens, if that happens, okay? And make sure your instructors know it, make sure you know it, make sure your instructors know it, and your junior instructors and senior students, like Kohai, should also know it. Even the first beginner students, they should know what to do if there's an emergency, okay? So 3 stages of injury care, and they're according to the degree of injury, okay? So if you have disruption or tearing of soft tissue, which is what most sports injuries are associated for, small blood vessels or major blood vessels which supply these tissues, they're usually also ruptured. So that leads to blood flow into and around the site of the injury, and we call that hematoma, which is like a bruising, or a hemorrhage if it's really serious. And you can usually recognize this by swelling and discoloration. Now, I just want to spend a minute or two on my theory on swelling and edemas. Over the years, if you're a serious instructor, you'll pick up an awful lot of knowledge regarding the human body, how it works, what happens when it doesn't work, any disruption of normal motion or normal procedure in just making your body do what you want it to do. You pick up all this. And I've had students come in and they've gone, I've got all my knees all swollen up or my hands swollen up around my wrist and I can't move it, and the doctor says I've got to put a brace on it or something like that. Now, let me just explain my opinion, and this is my opinion. When you get swelling around a joint, this is your body's own system for restricting that joint's motion. Now, the best cure for most injuries like strains and sprains is movement, but your body doesn't want it to move. And so the area is flooded with fluid, okay? And the fluid causes the swelling, and the swelling stiffens the joint, which is like nature's own bandage, if you like. So it restricts your movement. So what we do is we go back to very basic first aid procedures, which is we ice the area. When you ice the area, what you're going to do is you're going to get a flow of blood through the area and it will flush the fluid. okay? If you want to get a swelling down, you put ice on it. So the blood flows through, flushes out the fluid around that area. Now, you can use just ice, or you can alternate ice with heat. Now, heat is very comforting and ice is not so comforting. But what you get is you get a kind of a vascular flush around that area of the joint. You will reduce the swelling and recover your range of motion a lot quicker if you use a vascular flush. Now, when I've used vascular flushes, I've generally used them, cold heat, cold heat, cold heat. The modern theories of ice baths and stuff like that all achieve the same thing. They get a vascular flush. You get blood flowing through the area and flushing out the fluid to get your range of motion back so that you can start working the joint and bring it back to normal as quickly as possible. So these are just minor injuries, like soft tissue injuries like bruises and sprains. Be aware, though, of the difference between tendons and ligaments. And you can get occasional nerve and blood vessel involvement in those things, but just beware of them. Contusions, cuts, lacerations, scrapes, abrasions, usually more surface injuries around the epidermis, and you can stick Band-Aids on, a little bit of polysporin, antibacterial ointment, topical stuff. Even with sore muscles, you can use a topical, like an 85-3-5 rub. I tend to use the Chinese Soon oil, which is basically the same, high menthol content. So you get a lot of heat coming into the area, and it just takes the soreness out of the joint. And that's for very minor stuff, But your recovery time is going to depend basically on the type of injury and the severity of the injury. Of course, if it's a severe injury, it's going to take a lot longer than a minor one, right? The other thing that's going to affect your recovery time is early management. So quick, proper first aid will help shorten the recovery time. And therapy and frequency, okay? So you've got to select the right therapy and then apply it conscientiously with the right frequency. You may need to ice every few hours or ice every day, depending on it, okay? And of course, young students are going to heal faster. I can tell you right now that I've got kids that will fall over, look like they should have a fractured skull, jump up, and they're fine. They don't even have a headache. I fall over, it's going to take me 3 days to get up, and I'm going to be bruised, for another 6 weeks or whatever. But then again, I'm 80, and it's just going to take a long time. What you shouldn't do is not allow them to resume any vigorous activity until they can demonstrate full flexibility and 100% range of motion. And this is important because what will happen when you get going, if your range of motion is restricted because of an injury, it's very hard to hold back on trying to get your full range of motion. Like if you bang your elbow, just a quick example. You bang your elbow, of course you're going to hit the humerus nerve, which is people call the funny bone. You get a buzz up and down your arm, depending how hard you hurt it. Now, for a few minutes after that, you're not going to be able to get full extension of the arm, all right? And that's just a minor injury. That's where you've just touched the nerve. So imagine if you get an elbow, if you're doing an elbow strike, and I've seen a lot of people do this. One guy dislocated his elbow pretty badly. He kept trying to straighten it, which is the wrong thing. That needs medical attention almost immediately. The other thing I've seen with an elbow, an instructor once was just demonstrating how close elbow strikes are in application. So he stood against the wall, or close to the wall, maybe a couple of inches, lifted his elbow up to show that you don't push the elbow forward, you bring it straight up. Well, he actually did push the elbow forward and hit his elbow against the wall. It was a concrete block wall. Now, he chipped a little bit of bone off the top of the ulnar, I believe, and it's quite painful, but shook it off, right? And carried on because he was instructing, and I'm watching him and thinking, he's not getting full extension, but he kept trying to get full extension on his punches. And I'm not kidding, I spoke to him a couple of weeks later and he said it still hurt every now and again when he leaned on it. You put your arm on the side of a chair or the armrest of a chair. He said it used to hurt. I said, I think you may have chipped it or done something with that. So why don't you just go and get it looked at? Of course he didn't. 6 months later, he still had the same sensation when he leaned his elbow on the arm of a chair or on a desk or on a table. He had, in fact, chipped a little bone off, a little piece of bone off, not much, very, very small, but it's quite painful. And then he tried to get full range of motion within that joint. And, of course, the elbow is quite a versatile joint. It's almost rotational and leverage as well. So you have to be careful. What happens if you get a little chip of bone and it floats away or it's not looked at is it gets encapsulated. And it can restrict the range of motion in that joint. And it even cause a lot more pain, a lot more damage if it gets in between the bones of the joint as they're using it. So just be careful of that, okay? As I say, just watch it and don't permit full return to activity until they can show full flexibility. They should try to get to that as soon as possible, of course. A full strength return. You get some people who do push-ups and one side, oh, my shoulder's hurting, okay? This is another thing you got to watch. A lot of people don't have equal strength in both arms. Like I go to the gym and I watch people doing bench presses. They push one side up and then try to bring the other side up behind it. That is just going over your weight, all right? You got to work to your weakest link. So don't try pushing one side over the other. You need an absence of pain before you return to full physical activity or full training. You need an absence of pain. It's no good coming in and going, Sensei, I can't kick today, my knee hurts. Don't come in. Get better, come back when you can kick, all right? There's another thing about injuries, right? There's a psychological readiness, particularly comes after a severe injury, where you're always going to favor it or you don't want to try the same thing again. So there needs to be an absence of fear. You have to be able to fully commit to what you're going to do. So look for those things before you allow your students to come back to full training. As I say, we're looking for the injury groups, soft tissues, cuts, bruises, sprains. So muscles, tendon, ligaments, occasional nerve damage, but you'll know nerve damage almost straight away. Be careful of back injuries, as these are serious. It's easy to jam a nerve in the back. And be careful of head injuries. Have a list of what to do for each different type of injury and make sure this emergency list encompasses concussion checklist, okay? So with concussion checklist, there's certain things that you want to be looking for, and you can have delayed concussions as well. So just be aware of that. But have a little concussion checklist. Know how to check for eye movement, pupil dilation, that kind of thing. As I say, if you go through a St. John's or a Red Cross first aid course, then you're going to get all this information, how to administer first aid in different circumstances for different injuries. Okay. The one that we don't want to see is fractures or breaks. A fracture occurs when the force exceeds the strength of the bone. Now, you can have an impact fracture as well, and the force applied to the bone, of course, exceeds the strength of the bone to withstand it. So it's not uncommon in young people for a ligament or a tendon to be stronger than the bones and for growth plate fractures to occur occasionally. So as bones mature, it becomes a little less common. Injuries usually result to soft tissue rather than bones. Okay? But generally, you need to manage all fractures in the same way, namely splinting and medical referral. Splinting means basically to immobilize it, not try to put it back into place. Just immobilize it and then get them to a hospital or to some medical advice as soon as possible. So that's a fracture. Dislocation is a disruption of the place where the bones come together in a joint. So some joints in the body have a very limited range of motion, are quite rigid, like the bones in your midfoot. Very limited range of motion there, okay? as your range of motion in the joints increases, the stability of the joint decreases. All right? Now, you have like a shoulder, which is quite a large range of motion. You have rotator cuff, you have all sorts of stuff in there. And when the joint itself is unstable, what you're relying on is the muscles and tendons and ligaments to stabilize the joint. So bear in mind, when you get a dislocation, what you've done is you're going to have some ligament or tendon damage and possibly muscle damage in addition. Joints just don't come out of place on their own. All dislocations, again, splintered, in other words, immobilized, and then referred to a medical professional. So head injury is extremely serious and probably most vulnerable to injury, head and neck, I'd say. You've got to be careful because they can be fatal, and that's the last thing you want in your dojo. There's somebody getting hit in the head and passing away. So all head injuries, no matter how minor they look, should be considered serious until proven otherwise and should be referred to a medical professional. You can do your quick checks for concussion and everything else. But even if you don't find it, please be careful because it's not always obvious straight away. Okay? Now, some head injuries are going to be really obvious, or bleeding from the ears, or obviously deformation, like you see a dent in the head, well, there's going to be something wrong there. Okay? What is hard to spot straight away are internal injuries. Now, internal organs are not usually prone to injury, not easily prone to injury, but under severe forces, you can get some severe damage. And they often go undetected as the symptoms are not easily visible. Of course, they're internal, right? So generally, watch any change in behavior or biological functioning, such as nausea or severe persistent abdominal pain. Blood in the urine is usually indicative of a kidney injury. And I know we teach punching to the kidneys and the liver, but be aware that you can do some serious damage with these kind of blows, especially a forceful blow to the kidneys or the liver. I know they're debilitating, and we use them for self-defense, and they're very, very effective. But just be careful with that, and maybe keep a little log of somebody who's been hit there to see what happens. I remember a number of years ago we had a girl won the competition, but she'd taken a mawashi chudan, like a round kick to the area just above the belt, around the back. Her foot went round the back. Everything was fine, took her medal and everything else. She won the competition. And then on the way back, we were taking our equipment back to the dojo, our tournament boxes and stuff. Started complaining about pains in her back. Went to the toilet and freaked out. There was blood in the urine. So we immediately rushed her to hospital and found she had a slight tear in the kidney. Just panic stations. But the other thing that came about with that is she was forever scared then of getting round kicks to the body. And this is another thing you've got to watch out for, the psychological damage that an injury can do to a student. It can be sometimes quite severe, and maybe they don't ever want to do kumite again. So you have to plan your training around that. So look out for other stuff, other injuries, and these may not be injuries, they may just be like genetic disorders, but look for skin problems or infections like athlete's foot or fungus on the toenails. These things can be quite contagious, and you don't want somebody with athlete's foot training bare feet in your dojo and spreading it around. The same if they got bad toenail fungus, and we've had that. I've told people, go away, you can't train, or wear some shoes or something like that, wear some kung fu shoes or whatever. But you need to tell people, some people need to be told just for their own good. They think there's nothing wrong. But really, if you're going to be an instructor, an astute instructor will notice all these things, pick them up, and then advise on treatment and what steps you should do to get rid of it and get yourself fit for training. All right. So just a short chat on injuries and what to look for. And bear in mind that safety of the student is prime responsibility of the instructor. Thank you very much. If you have any other requests, comments, criticisms, as usual, give me a buzz. I'm more than happy to talk to you again.